I rise this morning to speak about a very important matter of public importance, which is North West Health Services. And I want to begin my contribution this morning by saying that as a local member advocating for my local community about issues that are incredibly important to them, like the provision of health services, is an important part of my job, and I'll continue to do that. And for someone that has a background in health and has worked in our healthcare system across the North West Coast, I feel very passionately about how we can improve the services that we provide to our communities. And I understand the need to always look at how we can improve the services that we provide, and the importance, because of our population and the different demands on our population, the importance of providing equitable health services right across our region. And I want to begin by putting my thanks on the record, Madam Deputy Speaker, to all of this hardworking staff that are working across our health services on the North West Coast. For our community and for our hardworking health staff, it's been a very difficult time over almost the last 6 months. As the House will be aware, we had the outbreak of COVID-19 on the North West Coast, and we had an extended period of lockdown which saw, which led to a very difficult time for our healthcare providers, and they continued to provide essential services for us and continue to do that now during that very difficult time. We had 5,000 staff and their families quarantined across the coast. We had the closure of 2 of our hospitals, and in particular our major acute hospital, and we had AUSMAT and the Armed Forces come in to manage those hospitals. And, throughout that time, the staff at the Mersey Community Hospital in particular held the fort for us, providing essential services along the coast, as did the hardworking staff at the Launceston General Hospital, whom I wish also to acknowledge and thank. And of course, the other important player within these changes to health service provision during this time are our paramedics. And I know through speaking with them that they're working incredibly hard and have had additional pressure, and I want to thank them for the work that they're doing. I turn my attention now to the changes at the Accident and Emergency Department at the Mersey Community Hospital. And I want to just take a moment to reflect on the Mersey Community Hospital, and quite rightly, as the Minister said this morning, there is a lot of community sentiment about the Mersey Community Hospital. The local community hold it dearly, and they fight passionately for it, and that's quite right. And in previous roles that I've held in the community, I understand the importance of that hospital to the provision of services right across the coast, and I understand and have advocated in other roles for the importance of the Mersey Community Hospital with my other community leader colleagues in the past. So, I think it's really important that we provide certainty for the community at this time. And, when there have been changes undertaken in the past, there has been good community consultation undertaken. That was particularly around the white paper and changes that were to take place. And one of those changes comes to mind is around the provision of maternity services and birthing services in particular being provided at the North West Regional Hospital. So I would like to put on the record that if there are to be significant changes at the Mersey Community Hospital, that we take the time to work with the community, talk to the community, explain to them any difficulties that there may be around the recruitment of staff, what the government's plan is around workforce development across the North West Coast, and what actions they're taking to try and address the shortage of staff, and obviously the need to provide safe staffing across both campuses to enable the provision of full services at both hospitals. On Monday, my colleague Shane Broad and I launched a community petition, which some of you may be aware of. And this is our call for the provision of safe staffing levels at the Mersey Community Hospital, and for the government to stand by its commitment to reopen the Mersey Community Hospital 24 hours a day. And we did that into response to a number of concerns that have been raised with us, not only by members of the community who have shared their experiences about sometimes very traumatic experiences, having to, in the middle of the night, be transferred either by ambulance or by their own family members to either Launceston or to Burnie, and the difficulty that meant for people and their experience. And of course we've had feedback from the staff, and we've been working with the unions also around some of the pressures that this is putting on staff, not only at the Mersey but also at the North West Regional Hospital as well. And of course the increased demand that they will be seeing, having to see patients from the Mersey region as well. And of course, all of this comes at the time when there's the independent inquiry into what happened during the COVID outbreak on the North West Coast. And I wanted to thank the government for supporting our calls for immunity for those workers, because that's very, very important for them to be able to tell their story and be protected to do so. And also for extending the timeframes for submissions, because this will be an important inquiry, that the independence of which is very important, and it will enable us to fully understand what happened during that time, but more importantly to prepare ourselves for the future and to make sure that our patients and our staff are safe. The integrity report that was tabled here in the Parliament yesterday, it's not the first one to be tabled around the provision of some of the cultural issues across the North West arm of the THS. And I've read the report and the incidences within it, and I don't intend to reflect on those in the chamber. But what I would say is it would be good for the Minister today to outline the government's actions in addressing some of those cultural issues. And I would really appreciate an answer to the question of whether the Minister feels that these cultural issues are actually contributing to the difficulties in attracting and retaining permanent staff to work within the THS across the North West region, because that's a very important question. The other thing I would like the Minister to outline is around a workforce development plan for the North West region and the work that's being done on that and the actions being taken by the government to attract permanent staff.
The honourable member's time has expired.